Good and bad foods for asthma. While there is no specific asthma diet, certain foods may have an impact on asthma symptoms and overall respiratory health. It's important to note that the effects of specific foods can vary from person to person, and individual sensitivities or allergies should be taken into account. Here are some general guidelines on good and bad foods for asthma. Good foods for asthma. Fruits and vegetables. Fresh fruits and vegetables are rich in antioxidants, vitamins, and minerals that support overall respiratory health. Include a variety of colorful fruits and vegetables in your diet, such as berries, oranges, apples, spinach, kale, and broccoli. Omega-3 fatty acids. Foods rich in omega-3 fatty acids, such as fatty fish, salmon, mackerel, tuna, flax seeds, and chia seeds, have anti-inflammatory properties and may help reduce asthma symptoms. Vitamin D. Some studies suggest that low vitamin D levels are associated with increased asthma symptoms. Include vitamin D-rich foods like fortified dairy products, fatty fish, and eggs in your diet. Sunlight exposure in moderation also helps the body produce vitamin D. Magnesium-rich foods. Magnesium is thought to relax the airway muscles. Incorporate foods like nuts, seeds, legumes, whole grains, and leafy greens into your meals. Bad foods for asthma. Sulfites. Some people with asthma may be sensitive to sulfites, which are food additives used to preserve freshness. Sulfites can be found in wine, dried fruits, pickled foods, processed meats, and some condiments. If sulfites trigger your asthma symptoms, it's best to avoid foods and beverages that contain them. Food allergens. If you have food allergies that trigger your asthma, it's important to avoid those specific allergens. Common allergens include peanuts, tree nuts, shellfish, dairy products, eggs, and soy. Follow your doctor's advice regarding allergen avoidance. Added sugars. High intake of added sugars and sugary drinks has been associated with increased inflammation in the body. Limit your consumption of sugary snacks, desserts, sodas, and sweetened beverages. Trans fats. Trans fats are unhealthy fats found in fried foods, processed snacks, commercially baked goods, and margarine. These fats may promote inflammation and worsen asthma symptoms. Opt for healthier fat sources like nuts, seeds, avocados, and olive oil. It's important to note that while certain foods may have an impact on asthma symptoms, they should not replace appropriate medical management and prescribed medications. It's always recommended to work with a healthcare provider or a registered dietitian who specializes in respiratory health to develop an individualized plan that suits your specific needs and dietary preferences.